Basically, my research has been devoted to biomarker development in hepatocellular carcinoma. So the recent studies, phase 1 data, which are still being produced as we speak, are showing that PD-1, PD-L1 targeted therapies are efficacious as a systemic treatment for HCC with a predictive overall response rate of 20%. So there is still an 80% of patients that will not achieve a radiologically objective disease response. And we know from other indications where PD-1, PD-L1 therapies have been developed that biomarkers are being developed to try and understand what is that 20% of the patients that do respond very well, sometimes even with long-term survival. And I think the focus has mainly been on PD-L1 expression, which is clearly a mechanistically valid target because it's the actual target being hit on the pathway. So the scope of my research was to try and understand how PD-L1 and PD-L2 regulation are actually distributed within primary metastatic disease. And we found a lot of heterogeneity, especially in PD-L1 expression, which mirrors studies that we performed in other malignancies, such as non-small cell lung cancer. And it's quite interesting to note that the molecular progression of the disease is also associated with the differential regulation of a host of immune regulatory pathways in primary metastatic disease. So overall, we performed RNA sequencing analysis in matched samples, and we could identify different signatures in primary metastatic disease. So we believe that these might have implications in terms of how we select patients for immunotherapy, and these should be obviously performed in prospective clinical studies.